Okay, this is the second part of the health and medicine chapter. So why don't we go ahead and get started here again. So, if we start looking at the percentage of health expenditures paid by the government, you can see how much the United States pays, which is located in the gray column, compared to France, Japan, Sweden, the UK. So the health expenditures by the government, while they might be high, they're not as high as places in Japan, Sweden, the UK, but they are much higher than some other countries, including everywhere from Cuba and, of course, third world countries. So begin thinking about that idea of how much healthcare costs in the United States. And here, if we look at this graph here, we can see that it has skyrocketed in the past 40, 50 years, and there's no end in sight. And again, the question is why? And there's lots of reasons. One, people are living longer than they have before. We've got a larger population. We've got technology that we've never had in the past that is, well, frankly, quite expensive. And of course, we have a lot of specialties that we didn't have in the past, whether we're talking about oncologists or certain providers that specialize in their medical field. They cost money, so it's not as general as it once used to be. One of the ideas, too, is HMOs. HMOs provide comprehensive care to subscribers for a fixed fee. So there's HMOs, health maintenance organizations, or PPOs. So we've got these different organizations which provide health care for individuals. So when we have these conversations of how best to pay for health care with these rising costs, we start to see a lot of different avenues for paying for them, whether we're talking about HMOs or PPOs, whether we start talking about government funding such as Medicaid and Medicare. You know, we've got these ideas, and Medicaid is for those that are in poverty, and Medicare for those that are older. So again, how do the theorists look at this? Again, we look at the functional theory, which tends to see how people function and how it functions, how the medical institution functions with people. So if we're talking about healthcare costs, we might look at that as a dysfunction in which certain people can't afford those. Or they might look at something like the sick roll. How are people supposed to act when they're sick? So if they call off work, do they act a certain way? So we look at some of the functions, how things operate in society, especially when we talk about medicine. The conflict theorists look at, just look at those that live longer than others. There's a clear distinction between those that live long tend to have higher incomes in this country than those that don't. The interactionist might see it as a meaning of health. What does it mean to be healthy? Do you have to live to 100? Is it living to 60, but you live a vibrant life? So they're going to start to apply these meanings, these labels, these symbolic ideas to health. And we might not necessarily look at health as, one being of capitalism or inequality or equality, and we might not look to see how things operate or not operate, but we might just look at meanings, symbols. So what's the future of healthcare? Long life is taken for granted today, and that wasn't the case even just 50, 60 to 100 years ago. It's becoming much more common. And go back to the aging chapter, and we know that it's becoming more common. We also know that individuals are taking responsibility for their own health more than ever before. Again, go back to the gender chapter, and we see who tends to take more responsibility: the women. And of course, as a conflict theorist will look at it, there's a double standard between the rich and the poor. I often say that we have some of the best healthcare in the world, but for those that can afford it. And unless you're living in the UK or Canada or some of these areas where there is national healthcare, right, we don't always have the best healthcare for everyone. But again, this goes back to this highly political debate nowadays. How can we pay for healthcare for everybody? And can we pay for healthcare for everybody? And what are the pros and cons to this idea? So that's the question we really started out with this national health care. And can we have it in the United States? Or is it a money thing? Is it an economy thing? Is it a social thing? Is it history and socialization? What is it that is preventing us from having a national health care? And is it worth having national health care? And this is a question you have to address. But hopefully some of these ideas in this chapter and in these prezzies here will lead you or help you make that decision one way or another. All right, this is the end of chapter 2 or chapter 21 on health and healthcare, and the end of the second part. Have a great one. We'll see you for our last chapter next time on the environment.